Yeah,
Okay, great. Well, welcome, Hazel. It's really lovely to have you here with me today. Could you please introduce yourself and how you got involved in tobacco harm reduction, just briefly?
yes, of course. My name is Dr. Hazel Lincy Ebenezer, and I did my PhD in human rights law. And I think what really drove me wanting to do a PhD in human rights law and being interested in sort of rights in general was very much two background factors of awareness and access. And awareness and access are things I've always been very passionate about. So making sure that people are aware of the options that they have and the rights that they have, and then that they have access to different opportunities. And that feeds in very well into my human rights career and flowed very naturally into tobacco harm reduction as well, which is a lot about making sure there's awareness of various options in tobacco harm reduction and then helping make sure consumers have access to those options. So that's kind of how I connected everything. And I've been really enjoying my work with THR.
Thank you, Hazel. Yeah, you've been working with THR.net or tobacco harm reduction.net for what, 18 months now, roughly? So
Yes,
you've got a
around.
really good kind of flavor for the challenges and the opportunities. So I'd love to ask you then my first question, which is to do with the tobacco harm reduction landscape and specifically global trends in THR. So from your perspective, what significant developments have you seen that are currently happening around the world?
Mhm. Yes, I think it's such a fresh topic that there's always developments happening around it. What's been very encouraging, especially to report on and show as success stories, is really what we see happening in Sweden, what we see happening in New Zealand, in the UK, where alternative products have been embraced and results are showing their worth and their use. In fact, for some research I was doing just a couple days ago, I was looking at Sweden again, and the success stories are very encouraging to share about. And I think quite hand in hand with the success stories, we're seeing a lot more research that's happening on nicotine products, on the difference between nicotine and combustion or nicotine and tobacco, which has been so misunderstood. And that also allows for more niche research or more particular research on things like flavors and the role that flavors plays in e-cigarettes, on things like illicit trade and the harm of illicit trade, which is happening whether we like it or not, and how that affects or informs our policy decisions.
Yes, I'm glad you mentioned Sweden and the UK because they are quite progressive countries when it comes to tobacco harm reduction. But can you think of other countries or regions like Africa or Asia, or even specific countries where there are really big challenges?
Absolutely. I do quite a bit of research in the Asiatic area. So there are a few challenges, and the problem is often that the challenges are very multifaceted. So, of course, there's economic challenges and financial access to these products, especially looking at how they're often taxed at a higher rate than cigarettes. So it's much more affordable to smoke cigarettes, even though with THR, we encourage a risk proportionate regulation, which says that tax should be according to risk. In which case they should be taxed at a lower rate. So that's one thing that plays into it. Another aspect, I'm sure in many countries in the world, but also in Africa and Asia, is cultural elements to smoking and various forms of um, tobacco use, whether it's smoking or oral tobacco use. And it's interesting how in countries, perhaps South Asian countries mostly, there's two sides to it. There's cultural taboos in some ways, and then also there's cultural expectations of smoking certain types of products. So in both ways, harm reduced products don't really fit into it. They face a taboo and they're not part of any cultural expectations. So that's another form or another layer of barriers that countries have to contend with.
Yeah, and this is quite a hard question because the lower middle income countries obviously have very different challenges to the high income countries. And you've mentioned some of those challenges, one of them being economic barriers which obviously play a role. Can you think of anything in terms of strategies for LMICs, and what steps can governments or NGOs or advocates like ourselves, what can we do to try and ensure there's equitable access to safer alternatives for smokers or even oral tobacco users, whereby there are smoke-free products, but they're very carcinogenic and toxic and they're unregulated? Are there any steps that we can take to try and minimize their risks and their use and try and advocate for safer alternatives?
Yeah, thank you. I think with low and middle income countries, and again, specifically in Asia, one thing that we've struggled with is that there's no leader in the field. Um, so far, there hasn't been a clear country that's kind of broken out of the mold and said, we will embrace THR. And then other countries who have similar economic profiles, similar cultural profiles, can see that it's working in a neighboring country and adopt it themselves. So I think that's a struggle we face as well. And another struggle is, as I mentioned, the illicit or the black market. For example, in Thailand, which I was researching recently as well, vaping is rampant. There is a very strong black market. However, it's completely outlawed, and the fines can include jail time and deportation for tourists. So there is a very clear discrepancy between what is happening in reality and what the laws look like. And another interesting country in the region is actually Malaysia, which has recently tried to bridge that gap. They've introduced a vape tax because they did see that there was a huge black market. And Malaysia, and I think a few other countries in the region, have a sort of gray zone where there wasn't a clear outlawing or a clear policy on vapes. But what has happened recently is responding to the black market that they're seeing. They've said, okay, we are going to tax vapes. We're going to put it under a policy, but tax it lower than they tax cigarettes. So that is risk proportionate. And there are positive elements to it. Of course, when it is a big shift that's happening, the government needs to make sure to also have social campaigns, have accessible information and correct information to accompany a shift like that. But it is encouraging to see countries like Malaysia responding, the Philippines as well, a couple of years ago, I think in 2022, introduced a vape law that has been very positive and very risk proportionate. So it is exciting to see changes happening. But yes, the illicit market is definitely a challenge. And another challenge is just misinformation. So making sure that people have correct information, scientific information, good examples to follow and look up to, and to see how those examples connect to their countries. So I
I'm
think
glad
that's very
So yeah, I'm glad you mentioned those examples because there is so much diversity in just one region in terms of how different countries and even neighboring countries have completely different approaches to tobacco harm reduction policies. So it can get very confusing to know what is the right thing to do if you're new to
yes.
the area. So I'm glad you mentioned those. Something else that you've been very actively working on in 2024 is policy submissions to governments. And obviously, these are very important if as advocates, if we're trying to encourage that governments do implement THR friendly policies. What do you think? Why do you think it's essential for advocates to contribute to these submissions? And how do you think they influence decision making?
Yeah, thank you. Policy submissions is something that I've been so excited to be a part of because it's a direct call from governments to people like us saying, hey, we want your opinion on this change we're thinking of making or on this shift in our internal structure. What do you think about it, right? And when you say advocates, and I'm sure you agree with this, it's not just us who work for a company or an organization like Tobacco Harm Reduction, it's actually anybody who is a consumer, who is interested, who is invested. So it's so important for all of us to feel like we have a say, and submissions are a great way to do that. And in
Mhm.
2024, I was able to be a part of quite a few submissions. For example, we were mentioning Africa earlier. We did a submission in Kenya because Kenya was talking about, the Senate was talking about introducing a law that would consider all forms of smoking related products to be categorized as smoking in general. So even synthetic nicotine or electronic nicotine would be categorized as smoking. And part of that law also was going to ban any flavors from being used in e-cigarettes. And we know from scientific research and studies that flavor profiles are a big part of people switching from smoking tobacco cigarettes to smoking nicotine e-cigarettes or to using vapes. And that's a big contributor to their success in reducing harm. So it's really important for us to be able to show the research, share our opinion. And, in the end, it's a public health matter. The government is there for the public. So voice is such a vital part of what we're doing here.
Thank you, Hazel. And just one final question, and it's regarding how to mobilise the THR community. So this is probably some good advice we can give to people who are maybe new to the community who want to learn more. From your experience, what are the most effective ways to either strengthen the movement or mobilise advocates in the community?
Yeah. That's a very good question. And I think a big part of it is strengthening and empowering individuals. And again, I think this goes all the way back to awareness and access, which feels so important to me. And in this sense, it would be awareness about what THR is, what it actually does, the fact that it is complementary to tobacco control. It is not a different strategy that works against tobacco control, and then access to information about THR, resources about THR. So I think step one is really for everyone to know that, on our website, on other websites like Oz, there are FAQ sections. We're currently working on a series called Back to Basics, where we talk about what is nicotine, what is tobacco, what is THR. And I think that's so important for people to then say, okay, well, I knew something else about this, and maybe this changes how I feel, or I would like other people to know how I feel about this. And if whoever is listening is already at that stage, a great step would be sharing. So please share our articles, posts, or any other information you find online with other people to help spread this information. And then I guess another step further is being part of submissions. So seeing what's out there, we also this year hope to share more about the submissions that we're doing so others can also be a part of it if they'd like to. And I think that gets the ball rolling, and once it has enough momentum, there's no stopping it.
Thank you. Very well said, Hazel. Thank you very much for your time today.